Historical Overview of U.S. Healthcare Delivery by Professor Tammy. Historical Overview of U.S. Healthcare Delivery, Part 1.
Introduction. U.S. healthcare is mainly a private industry, but it receives a large amount of government financing, so it receives a lot of money from the government. Historical factors that shape the U.S. healthcare delivery system, which you can look at page 51, Exhibit 3.1, Major Forces of Change in the U.S. Healthcare Delivery. So, the U.S. healthcare delivery system is complex. It has complex interactions between agents of change. For example, the Affordable Care Act. Just to let you know, the Affordable Care Act is nicknamed Obamacare. They're the same thing. And sometimes if you see ACA throughout the PowerPoint slides, that means Affordable Care Act. Alright, so as far as complex interaction, that means that the healthcare system can be tricky and difficult to change. Social, political, and economic forces lead to compromises. These are the forces that are important. Which force do you think is the most important? Yeah, a lot of you might think social, political, and economic, they're all important. But remember, money talks. And it has the most power of the three forces. Medical practice in the United States is highly specialized. That means a lot of doctors have a specialty versus being a generalist, also known sometimes as family doctors, which we tend to lack of. So there's more encouragement now, or less slots to be a specialized doctor, so more encouragement to be a general practitioner. Example of doctors who have specialties are like dermatologists, they deal with the skin, pediatrician, they deal with children. Even though pediatricians tend to be like a generalist for children, but they're also at the same time a specialist for children. And hematologists, they deal with blood. They're like the blood doctors. Healthcare's evolution has followed 4 distinct time periods. And it's important to understand history and understand each time period or era. So the 4 you have to really understand is 1, pre-industrial era, 2, post-industrial era, 3, corporate era, and 4, era of healthcare reform, which is still in its infancy. We are still in the early stages of healthcare. Medical services in the pre-industrial America. This is going to be interesting. Strange domestic character. Primitive medical procedures. Ooh. No health insurance. So when you go into your book, Exhibit 3.2, Healthcare Delivery in Pre-Industrial America, you want to look through this. Medical training and education was not grounded in science. Primitive medical procedures were practiced. Intense competition existed between any tradesman could practice medicine. People relied on family members, neighbors, and publications for domestic remedy. Physicians' fees were paid out of personal funds. Healthcare was delivered in a free market. Hospitals were few in number and located only in big cities. Hospitals had poor sanitation and unskilled staff. Almshouses served the destitute and disruptive elements of society and provided some basic nursing care. State governments operated asylums for patients and untreated chronic mental illness. Pest houses quarantined people with contagious diseases. Dispensaries deliver outpatient charity care in urban areas. So let's talk about the medical training during that time. Until about 1870, medical training was largely received through an individual apprenticeship with a practicing physician rather than through a university. So there was no formal training. Let's keep going. Mainly out of economic necessity, American physicians began opening medical schools. There were only about 42 such schools in 1850. At this point, medical education was still seriously lacking in science and standards. Not everyone was trained in the same way. Not everyone understood science or had a high school degree. Today, will you go to such doctors? Medical practice. Medicine was a trade without today's prestige. No rigorous course of study, clinical practice, licensing, etc. Anyone, trained or untrained, could practice as a physician. For example, barbers did bloodletting. Now, will you go to your hairstylist and do a bloodletting? How scary. Do you know anyone who does not have medical training and likes to give medical advice? So there was intense competition there with the medicine as a trade. Medical procedures were very primitive. Inhumane treatment of mentally ill patients, limited surgical techniques and technical expertise. The clergy often combined medical services and religious duty, so it was a mix with medicine and religion. Many physicians had second occupation because income from medical practice alone was inadequate to support a family. So they didn't make that much money back then as physicians. Strong spirit of self-reliance in rural America due to difficulty of access to physicians. So they didn't have access to a physician. So it was sometimes hard to get a doctor. Medical institutions. Remember the names of these type of institutions because they're going to come up in your exam. Almshouse, asylum, pest houses, and dispensaries. Hospitals were few and had deplorable sanitary conditions and poor ventilation. Ooh. The almshouse, also known as poorhouse, was the forerunner to modern hospitals and nursing homes. So forerunners, they're almost like first place. They were squatted and used to confine unwanted elements of society. The asylum was the forerunner to modern inpatient psychiatric facilities. Pest houses were operated to isolate people with contagious diseases. Dispensaries were staffed by medical students or apprentices and established as outpatient clinics to provide free care. Medical services in post-industrial America. So there was growth and development of advanced medical profession, formation of professional organizations, and effects of private practice. So when you look at your book, Exhibit 3.3, Notable Developments During the Post-Industrial Era, there's more urbanization, scientific discovery, and their applications in science, such as advanced science-based treatments, raising healthcare costs, and balance between specialists and generalists. So there was an imbalance of that. Medical education reform. So they changed the way doctors are educated. Power and prestige of physicians. So they're getting better recognition. Organized medicine, control over medical training, powerful political interest group, support of licensing laws, opposition to national health insurance proposal, support of private entrepreneurships and medical practice. Hospitals became true medical care institutions, reform of medical health care, growth of private health insurance, and creation of Medicare and Medicaid. So you see that how pre-industrial America has changed when it got to post-industrial America when it came to medical services. Medical profession. Urbanization means it's either in the city or a place with a lot of people. Office-based practice began to replace house calls. So instead of the physician going to people's home to check in on them, people go to the offices of the physicians. In the past, the doctors used to make house calls and go to people's homes. House calls are actually coming back now because of the baby boomers. They're getting older and it's easier for them to have the doctor go to their homes instead of going to see the doctors. But since 2020, we're starting to have more telemedicine. Like we can, talk to our doctors through our smartphones or through the computer. Medicine became driven by science and technology outside the domain of laymen. That means regular people. Groundbreaking medical discoveries further legitimizing the medical profession. So, it's looking better for the medical professions. Undesirable effects of emphasis on science and technology, bias towards specialization in medical practice. There's also an increased cost of medical care. So more education, more science, technology, and equipments lead to higher costs in medical care because of all these cost money. So when you think about if you don't have to use so much equipment, medical care will be cheaper. But since you have all these technology like x-rays, CAT scans and stuff, that costs money. Someone has to pay for these machines, especially they cost buku bucks, millions of dollars. How are you going to make up the money to pay for the machines? You have to up your costs. Exhibit 3.4, Groundbreaking Medical Discoveries. These are a list of people who had the progression of science and medicine. So read page 58, Exhibit 3.4, Groundbreaking Medical Discoveries. 1. Horace Wells discovered anesthesia. Number 2. Ignaz Semmelweis, aesthetic technique. 3. Louis Pasteur, germ theory of disease. 4. Joseph Lester, father of antiseptic surgery. 5. William Roentgen, discovery of X-rays. 6. Alexander Fleming, discovered the antibacterial property of penicillin. See you soon, and remember to read the book.